great to be here back in Birmingham after being gone for a couple of decades. And when I talked last night, I told the group, the new incoming students at the School of Public Health, that in the penultimate decade of the last century, I was working for the health department. Sounds like a long time ago. Actually, it was. But I'm going to talk with you today about some memorable things I was involved in during my decade here in Birmingham. I know you've got the 100th anniversary that you're celebrating for caring for your community. I'm also going to speak about collaboration that the Jefferson County Department of Health enjoyed with the CDC and with local academic groups here in Birmingham. And a few interesting snippets of community communicable disease control that I think you might be interested in. My intent is to give you maybe some part of the history of the health department that you didn't know. And I would hope that you would know it as you go forward in your work, both at the Department of Health now and in the School of Public Health. As it says, I was director of the Bureau of Communicable Diseases. I have to ask Mark, is it still called that, or is it called disease control? Disease control. So it's changed after I left. And I was called the county epidemiologist, but I will say I didn't really have any formal training as an epidemiologist until I went to the School of Public Health, but that was a couple of years later. I want to start by paying tribute to a few of my colleagues who have gone on. And Dr. Carol Samuelson was a health officer who I served under. Dr. Mary Ann Pass was a deputy health officer. And Michael Metz, that you mentioned, was the public health veterinarian for Jefferson County until 1976 when he joined the faculty at the School of Public Health. And finally, Richard Holmes, who I worked very closely with in some of the investigations and activities that you'll see later. There are many others. I mean, I thought of Vita Hampton as I was walking over here. You know, Vita was in the Navy Reserve, and she was on active duty in the UK and was hit by a car, didn't make it back. She was an environmental engineer with the Department of Health. Very, very nice lady. Many others, too numerous to mention, that I've lost track of. But in any event, we have public health professionals that have been very committed to maintain the public health of Jefferson County and Alabama, and I'm presenting this in tribute and remembrance of them. So how I found my first real job at the Jefferson County Department of Health. You know, you have your first real job. I completed an internal medicine training in UAB in '76. I had the fellowship in infectious diseases for 3 years. And as part of that, I was a clinician in the Jefferson County tuberculosis clinics. We had 6 clinics a week. We had 2 in South, here in Central, South. And we had 1 in North Birmingham, 1 in Bessemer, 1 in Inslee, and 1 over in Eastlake. So we're 6 a week. In 1976, Alabama was number 3 in the nation in tuberculosis rates, behind Hawaii and Alaska. So we were number 3 in the continental United States. So a big job, big committed staff, lots of contact investigations that went on during those years. And now, in 2015, Alabama is number 21, in case you want to see the changes that have been in the rates. I was recruited by a tuberculosis clinic nurse, Donna Bailey Decker, who said, there's a job at the Department of Health for a physician. You may be interested. And at that time, Dr. Bill Bailey was the interim medical director for the Communicable Disease Bureau. And so I was recruited by Donna and Bill Bailey and took the job, hired by Bill Roper, who was in the Jefferson County Department of Health officer. So my responsibilities were tuberculosis treatment and control, and I've told you how many cases we had. We had 3 new smear-positive cases a week. And for every smear-positive case, you have your contact investigations, which may number 8, 10, 15 people. STD treatment and control was also my responsibility. I totaled up the number of visits when I left in '87. It was 35,000 per year. I don't know what it is now, but it was. We had clinics every day and 3 nights a week, and it was 35,000 visits to the STD clinic. The vaccine preventable disease surveillance was part of this. Bill Roper had put into place the requirement that all children be completely immunized to go to school. And so we had active surveillance for any vaccine-preventable diseases. And finally, general epidemiology, which was everything else. We met every Friday and looked at the MMWR that came out and looked to see what was going on in the United States from the CDC, and kind of used that as a jumping off place to think about what we could do and what we should do here in Jefferson County to impact the health. And finally, at the very bottom, I have a comment from a physician colleague in town. When I told him I was taking a job at the Department of Health, he said, "Oh, they keep very good records." And I'll come back to this later, okay? All right, so let's go back to 1979. Bill Foege in the center, director of the CDC, presented the first seminar in the UAB Department of Public Health fall series, The World Eradication of Smallpox. So this was in October of 79. The last case of smallpox occurred in October of 77. So with a 2-year span, no more new cases, and the world was declared free of smallpox. Bill Foege came by. This picture's taken right over there at the Department of Health building. On the left is Dr. Bill Roper, who hired me, the Jefferson County Health Officer from 77 to 83. He is now the Dean of the School of Medicine and the CEO of the North Carolina Healthcare System, UNC Healthcare System, also a professor in the School of Public Health. He was CDC Director from 1990 to 1993, and from 97 to 2004, he was Dean of the School of Public Health in UNC before he became the Dean of the Medical School. Now that is me on the far right. Bill's on the left, on the far right. So I joined the Jefferson County Department of Health in 1978, and Bill arranged for me to go to Atlanta and attend the Epidemic Intelligence Service training course, a 3-week training course in Atlanta at CDC, and to prepare me for my role as the county epidemiologist. And this experience really excited me to interact with those EIS officers who were there. I think Charlie Wernley eventually came to Alabama as assistant health officer, I guess. He was part of that group. And it fueled my passion for what we call shoe leather epidemiology. And so I pursued that with vigor for the next decade. I wanted to go through the health officers of Jefferson County. Mark is here, you're there at the end. Go back to the beginning, Judson Dowling, who was actually a lawyer who then went to med school and became Jefferson County's first full-time public health officer in 1917, and served in that capacity for 24 years. If you look down at the bottom, as Greg Townsend knows well, Dr. Dowling was tarred and feathered. He was berated, kidnapped, maltreated, warned to leave the city because he tried to clean up the milk supply. He tried to make the milk healthy. He survived that and was health officer for 24 years and fighting battles against rabies, tuberculosis, and poor sanitation. Next came George Dennison. I don't know how long he served. Probably Greg does. But he was succeeded. He served into the 50s and succeeded by Carol Chambers. And then George Hardy in 67 for 10 years. And Max reminded me this morning that George Hardy is responsible for enacting the Clean Air Act to clean up the air in Jones Valley. Is that where we're in? Jones Valley. The valley that we're in, where the steel mills were all, the smog was here, and George Hardy shut down the steel mills to clean the air. No telling how many respiratory diseases were prevented by his actions. I've already mentioned Bill Roper, who succeeded George Hardy. Bill is a UAB School of Medicine alumnus. He's a School of Public Health alumnus, and he's in North Carolina now and has a very big job with UNC Health Systems. Mary Tiller filled in for a couple years after Bill left, and then Carol Samuelson became health officer in '85. And you can see that she, after Judson Dowling, she's health officer for 17 years, very long term. Michael Fleener next, and then Mark Wilson in 2012. So that gives you the past 100 years. So here we are, March the 12th, 1947, groundbreaking for the Jefferson County Public Health Building. Who knows where this was? Where would you find it now if you were to go back there? No, it's where the Tinsley Harrison Tower is. That's where it is. So on the left is the newly elected Governor James Big Jim Folsom. Second from the right is the Jefferson County Health Officer George Dennison. This ceremony illustrates a close affiliation between the Jefferson County Department of Health, which they call the Public Health Department, and the Medical College of Alabama, since Dr. Dennison was the school's chair of the Department of Preventive Medicine and Public Health. I don't know who the other two individuals are. This is actually taken from the book that was published about UAB several years ago. And of course, little Jim Folsom became governor later and got the Mercedes plant in Tuscaloosa County, I think. Yeah. See, I haven't lived here in a long time, but I still know a little bit of the history. So here's the public health building, erected in 1947. You can see the city commission. There's Cooper Green, the president. There's the infamous Eugene Bull Connor, who's the associate. You can see the Board of Health, and Dr. Dennison at the bottom is the health officer. I think there are a couple of new students in public health from Pinson. I think Pinson's named after Clarence. Here's the building, built in 47. This is where I first started working for the Department of Health. Is anybody here who worked in this building? Oh, in the back. Okay, great. Yeah. It's a kind of an Art Deco looking building, but I've drawn an arrow to the door that was labeled Southern Adult Clinic, which is a STD clinic. That was there, and then a tuberculosis clinic was also down the hall. So that's where I first started seeing patients for the Jefferson County Department of Health. And again, this is where the Tinsley Harrison Tower is now located on University Boulevard. Well, here's my outline to keep your interest. I'll start with the event potentially leading to the creation of the Department of Health in 1917, the typhoid epidemic linked to ice cream, investigated by Leslie Lumsden. And the other 6 topics, the second group there are things that I think I would like you to know about the Department of Health's collaboration with the academic community here and also with the Centers for Disease Control. And these were kind of a little bit before and during my time at the health department. And finally, the third part are a few memorable investigations, field work, and things that I hope you'll find interesting and illustrative. So we'll start with Dr. Lumsden. The typhoid epidemic of 1916. Leslie Lumsden was a public health service medic. He attended the University of Virginia Medical School, entered the U.S. Public Health Service at age 23, worked on Ellis Island, was on a troop transport in the Spanish-American War. He became kind of the go-to guy for typhoid epidemics, from what I can tell. So he came to Birmingham in 1916. He went to Huntsville, I believe, in 1917. But in the summer of 16, he investigated about 350 cases of typhoid here in Jefferson County during June, ice cream-borne infection. He found that in Birmingham, turns out 3 workers at the dairy supplying the milk for this plant making the ice cream were carriers of typhoid. They had typhoid in their guts. They were obviously contaminating the milk that they were producing. And then the quote is in his publication from 1917, "And unless investigations of typhoid situations are conducted painstakingly and thoroughly, evidence which would definitely establish an ice cream supply to be the vector of infection may be missed." Here's his publication in the American Journal of Public Health in 1917, read before the Public Health Administration section of Washington, October 1917. The outbreak of typhoid fever in Birmingham in the summer of 16, another Chattanooga, wasn't Huntsville, Chattanooga, was also due to ice cream. And if you look at the number of cases, the cases in excess of what's expected, now we don't expect any typhoid these days, but the excess in what's expected was something like 1 in 428 or something. Excessive case incidence in Birmingham was 1 to about 428 of the population. Amazing. So fast forward to 1916, from 1916, excuse me. Marvin Doc Gilchrist opened the Mountain Brook Apothecary in Mountain Brook Village in December 28. Not long after that, it became known as the name that goes by today, the Gilchrist Pharmacy. Like many drugstores in that area, they had a soda fountain, and all the pharmacy moved out in the mid-1980s. The fountain and lunch counter have remained so. In 80-plus years, Gilchrist has had only 4 owners. It remains the oldest continuing business in Mount Brook Village. From 1928 into the 30s, the store employed the counter-freezer method of ice cream making in violation of Birmingham city codes. Here it is. You can go right over there today. You can walk in and have some soda. That's it.
No ice cream.
I probably have ice cream. But it's right up there on the corner across from Starbucks in Mount Brook Village. Okay, so they're making ice cream by the counter freezer method, and Birmingham says you can't do that. There's a city code against it. Well, they brought suit against the Birmingham city about this city code that they were in violation of, and this code was inspired by the typhoid epidemic in 1916 as a result of Dr. Lumsden investigation. So this is 20 years later, and that was inspired by it. And here's the code. All ingredients used in manufacturing ice cream for the public must be pasteurized, flow or conveyed through appropriate pipes or conveyors in the pasteurizing apparatus, directly into the freezing apparatus, et cetera, et cetera. So here's a lawsuit about typhoid. So it went to the Alabama Supreme Court. It was decided by Justice Lucian D. Gardner, who served on the Supreme Court from 1914 to 1951. He was the Chief Justice from 40 to 51. And I thought this was an interesting quote because they decided for the city. The city won against Gilchrist. But if you look here at the last sentence about medical profession, their labors are not to be restricted to curing disease and alleviating suffering, however important these may be, but the greater benefits are to be realized by the use of preventive means in anticipation of the danger of an epidemic. So this is part and parcel of what you do in public health. You prevent epidemics, you prevent cases. In 1936-37, Supreme Court of Alabama affirmed that mantra. They were smart, yeah. Okay, collaboration. I have about 3 examples of collaboration that I want to bring to your attention. The first is how Jefferson County Department of Health personnel contributed to the description of maternal neonatal cytomegalovirus infection. Now, this is one of the double-stranded DNA viruses like herpes and CMV. And, it can be a bad actor, especially in people that have had transplants and are immunosuppressed. Well, in 1973, there's a paper in New England Journal. I've circled Mary Tiller's name. She was the health department person in charge of the maternal child health division at the Jefferson County Department of Health. And again, as I showed earlier, she was deputy health officer and then health officer for a couple of years. The other individuals are at Children's Hospital, David Reynolds, Sergio Staño, who I think just retired as the chair of pediatrics. I don't know Thomas Hosty, but Charlie Alford was the senior person in that group. And it's an example of how we have, the Department of Health collaborated with the local community and was credited with that effort. This effort went on in the maternal child health clinics at the Department of Health. And it was either over here where you work now, or it may have been down the street. But in any event, all 500 women who were in the study were seen in those clinics. And again, the findings were that these children were being infected with cytomegalovirus probably during the time of delivery. But they were basically asymptomatic, but they were infected with cytomegalovirus. So the next collaboration that I want to bring to your attention is the collaboration between the Department of Health in confirming the viral etiology of AIDS. And I would just like to show of hands if you are aware that this happened. Got 1, 2, Mona. So I want to show you what happened and how we were involved with this back in the mid-'80s. In 1983, in March of '83, there's this front page of a Science magazine. First it killed gay men, then drug addicts, Haitians, Hemophiliacs, and now some medical investigators fear the disease could spread through the nation's blood banks. No one knows its cause. March of 1983. Well, historical perspective was the syndrome was described in the late 1970s, 1979, actually the initial description of Kaposi's sarcoma opportunistic infection, KSOI. Syndrome more completely described in 81, named AIDS in 82. Again, don't know the cause. In 83, the agent was discovered. Screening of blood donors began in 85. In 1981, Jim Curran at CDC was tapped to lead the CDC task force charged with determining the cause of AIDS. He was a pioneer in HIV/AIDS prevention. He led the nation's efforts in the battle for 15 years before joining Emory as Dean of the School of Public Health. I believe he's still there. In the summer of 83, I was over here in the office on the 4th floor on the corner, and Jim Curran called me and said that a blood donor from Atlanta, a homosexual man, had given blood through the Red Cross, and that his CD4-CD8 ratio, at that time we called him T4-T8, was abnormal, and his blood had been given to a cardiac surgery patient in Birmingham. Dr. Curran requested that I interview and obtain blood specimens from WS, or his initials, who lived in Trussville. So I made a home visit. This is one of the exciting things about public health. You get out there. Shoe leather epidemiology. You get out there. So I made the home visit. I remember sitting under a tree in his backyard. He had an Adirondack chair he was sitting in. And we talked about this. He had a surgery 2 years earlier. And he gave permission. CDC sent me all the forms. This was informed consent. It gave permission for his blood to be drawn, and I sent it off to CDC. I will say that the story about the donor was that he worked in an office, and the Red Cross came to collect blood from everybody, or anybody who would give blood, and he had not come out. He was not. People didn't know. He felt pressured to give blood because he didn't want to say, "Oh, not me," So that's the way it came to be, that he donated blood. Well, this was in August of 83. I drew WS's blood. And then in January, we had a publication of AIDS associated with transfusions. And I've underlined at the bottom the fact that CDC will give you credit for collaborating. They're very good about that. So you can see that we have credit for collaborating. The Tennessee Department of Health also collaborated in this investigation. So that's January of 84, and in March of 83, we didn't know the cause of HIV. We didn't know the cause of AIDS. But now we have data that it is transmitted through transfusions. And this table from that paper at the very, very bottom shows case number 13, who was WS, and there were 6 donors of the blood products that he received, and one of those donors, the man from Atlanta, belonged to a high-risk group, and he was asymptomatic. So the investigators at CDC went on to show that the donor had persistent infection when he gave the blood. And this is a table from that publication showing that donor 3 was healthy when he gave blood in August of 81, and WS here in Birmingham received the blood in August of 81. And the specimens I collected in August of 83 were positive for virus isolation, at that time called HTLV. And so this is the first evidence of spread, viral etiology spread by transfusions. And I'm very proud that that Jefferson County had participated in this investigation. And it's not only me, but other people in our general epidemiology department who assisted in it. Okay, thirdly, I have the identification of hepatitis C virus as an etiologic agent of non-A, non-B hepatitis in 1989. Currently in the U.S., there's an estimated 3.5 million people infected with hepatitis C virus, and half of them don't know they have it. And that's why that recently the CDC has recommended that any baby boomer be screened for hepatitis C virus. Baby boomers between 1945 and 53. Now, I'm not sure how completely that's being done, but It's just because the asymptomatic hepatitis C virus can lead to cirrhosis, can lead eventually to liver cancer, and there are now treatments for hepatitis C. But anyway, going back to the 1980s, the CDC instituted what they call the Sentinel County Hepatitis Study Group. This was under the direction of a lady, Dr. Miriam Alter at CDC in the hepatitis branch. And I've highlighted Richard Holmes' name in the byline here as one of the authors because I credit Richard as really pushing this forward as the head of our epidemiology division. There were, at this point, 5 counties in the U.S. that were sentinel counties for hepatitis non-A, non-B. Pinellas, Florida, which is down Tampa area, Jefferson County, Orange and San Diego, California, and Pierce County, Washington. And I've highlighted the Jefferson County line because in 13 months, 60% of the reported cases of non-A, non-B were serotested for A and B. So if they're negative for A, negative for B, then they had non-A, non-B. So Jefferson County could be proud of this. We were just second behind Pierce County. And that's why Orange and San Diego dropped out because you can see their percentages are pretty low. So CDC went away from them. They brought in Denver as a county that had a good surveillance system for hepatitis in the community. So that was published in '84. Don Francis was the lead author. And the next slide shows on the left the Jefferson County proportion of acute hepatitis. 14% was A, 59% was B, 27% was non-A, non-B. And Dr. Francis says our understanding of the transmission patterns of non-A, non-B is just emerging without specific serologic tests. Again, 1984, no tests. The potential varieties now included. Be rather cautious. Like hepatitis B, the agents produce chronic viremia, and thus percutaneous transmission is possible. It's amazing to think back of what's happened since then with the discovery of the hepatitis C virus, which was actually the blood we collected, the Sentinel counties collected, was sent off for examination of the presence of hepatitis C. And they were able to recover hepatitis C from that blood, develop tests for screening, so that by a couple years later, we'll see that the testing for blood was routine. The testing for hepatitis C in donated blood was routine. And then Miriam Alter, who's the lead author here, went on to have us do some studies on the natural history of community-acquired hepatitis C in the U.S. And I've underlined again Jefferson County Department of Health, the people that participated. And here you have the collaboration and the continuity. You have Michael Fleener now listed as the person who's the the health officer. Jane Foster, Stephen Hill, Richard Holmes, Joe Shaw, Larry Wafer. Steve Coleman is a gastroenterologist who did liver biopsies on these patients if they agreed to have it, to look at the presence of chronic liver disease. So this is the Sentinel County's chronic non-A, non-B hepatitis study team. But now we have the identity of this virus as hepatitis C, and there are multiple ways to treat it now. I mean, there's direct acting antivirals. They're very expensive, quite expensive, but they are potentially able to cure hepatitis C in people that are found, but you got to find them before you can treat them. So that's kind of the next task. Okay, I'll move on to a couple of interesting investigations. Check my time here. Okay, we're doing okay. I'll have time for questions, I guess. I may not have any answers. Time for questions. Typhoid in Graymont, 64 years after the Lumsden investigation. Raise your hand if you know where Graymont is. Okay, good. In 1980, patient RM was hospitalized at age of 3, I guess, at Children's Hospital with fever, followed by vomiting, followed by diarrhea, and hospital admission on the 1st of September, 1980. Salmonella typhi identified in blood and stool from him. Treated with ampicillin, it was ampicillin susceptible, and he recovered. And then it gets reported to the health department. So what do we do next? What Dr. Lumsden said, vigorous investigation, right? So I'll credit Joe Shaw and Richard Holmes and the Epi group for jumping on it. And so the child lived in this house there. You see the Graymont you see the Graymont pillar. Somebody carved PS plus BW on the pillar. If you stand at this pillar and turn around, you see Legion Field right behind you. So this picture was taken in the fall of 1980. I was in Birmingham here in June of this year, and I knew I was going to be giving this talk, so I went to Graymont to see what I could find. Well, the pillar is still there, and the initials are still there, but the house is gone. The circle there where the house was, it's not there anymore. The next house is there, but that house is not there. So I'm not sure what happened to the house, but it's kind of interesting that it still looks about the same as it did in 1980. So our actions in the Department of Health regarding patient RM was the immediate household numbered about 16 people, 14 people. Anyway, these were the people living in that house. And so our actions were to collect stool specimens and offer vaccine, typhoid vaccine, to the close contacts in that house, which we did almost universally except for the 150-year-old male who refused. And there's a 26-year-old female and a 54-year-old female who tested positive stool result for typhoid. So following some guidelines that in place at the time, we gave ampicillin and Benamid to increase the ampicillin levels for 6 weeks to those two individuals. And Mark can tell me if this is what you do now, I don't know. I've been out of this for a while. But we gave... Huh?
We see it every day.
You do? He says we see it every day. I doubt that. So we gave for 6 weeks. Again, this was not directly supervised therapy, so I don't know if they took it or not, but I think maybe we checked on them every week. And the lady, the 26-year-old lady, became negative, but the 54-year-old lady was still positive. And so we surmised she might have some gallstones where typhoid was living. There were 3 other households where RM had stayed. 9 persons, they all had negative stools. We didn't give them the vaccine. So the outcome of this was that we referred the 54-year-old lady to Dr. Charlie Bro at Cooper Green to see about having her gallbladder taken out to potentially eradicate the typhoid carrier state. So 23 individuals screened for this one case in a 3-year-old. And we may have missed some people, but this is a good example of how your work as a public health person probably not appreciated by many people in the medical community, how much you do and how hard it is to do it. And this is a good example. Okay. 64 years later, still typhoid around. I don't think there was any ice cream. We asked about ice cream. All right. My next little topic is aseptic meningitis and increased risk during pregnancy. And I've titled this Poliovirus Deja Vu. So I'm sure many of you in the room have not thought about the increased risk of enteroviral disease during pregnancy. Well, we investigated this in 1983. Richard Sugarman was a medical student who took a public health elective. I had this public health elective for medical students and also for medical residents. People came through and spent a month or so in the public health department working on whatever comes up. Richard Sugarman was one of those medical students. I tried to find out where he is. I don't know where he is. Anybody know? No? Anyway. There is a Richard Sugarman who's an ophthalmologist in Miami. I don't know if it's him or not. But we had Richard Sugarman as far as the medical residents. We had John Ward, who's now, I think he's chief of the hepatitis division at CDC. Very influential in hepatitis C virus epidemiology, treatment, just overviews. We had Janet Airsmith, who became the editor of the MMWR for a little while, who came through on a elective. But anyway, Richard Sugarman was there, and I said, Richard, we're having a lot of aseptic meningitis this summer. Why don't you help? So we had 236 cases reported of aseptic meningitis in Jefferson County in the summer of '83. And you see here the ages, the gender, and you see that there were some non-pregnant females and there were 7 pregnant females, yielding percentages, attack rates in pregnant women, or proportions of 10% to 14.3%. So in any given community, at any given time, between 6 and 7% of women between the age of 15 and 44 are pregnant. So our percent of pregnancy here was twice that you'd expect. Has that been seen before? We'll talk about it. We had specimens cultured at the Alabama Department of Public Health laboratories, also probably at Children's Hospital as well, but you can see here that it was Coxsackie B5 enterovirus. In Coxsackie, New York was where the virus was first found, but this is a member of, there's like 70 different types of enteroviruses. And there's Coxsackie B through 6, and there's enteroviruses and there's echoviruses. So we had mostly Coxsackie B5 exposure or experience here with these cases of aseptic meningitis. There was one echovirus. Go back to 1951. Epidemics of polio, paralytic polio in New York, in Boston. Louis Weinstein, one of the godfathers of infectious disease, published this article in 51. The relation of sex, pregnancy, and menstruation. This is not sex, this is gender. The relation of gender, pregnancy, and menstruation to susceptibility to poliomyelitis. This is his chart from that publication. These were women who were not pregnant. These were women who had onset of their polio, and the case definition involved paralysis. They had fever and they had flaccid paralysis. And the onset of their polio symptoms was closely related to the time of onset of the menstrual period, 5 days before, 5 days after. 78% of those cases occurred in that period of time. So we found this a little bit interesting to go back and look at polio back in the late 40s and 50s. And so we plotted, we interviewed, I say we, Lee Loader, Joe Shaw, Richard Holmes. We interviewed these, as many of these women as we could to determine how their onset was related to their menstrual period. And we developed this slide, which I hadn't seen in about 15 years, but I found it in the attic, and I brought it out, and apparently I did this because it looked like the slide that they did in 1951. Looked very similar. So in 68% of our case, our 16 women that we interviewed, there were about 50 women between the age of 15 and 44 who had aseptic meningitis that summer. We were able to interview 16 and determine when their menstrual period began. And this looks, very similar to what you saw with polio. So I just think it's an interesting data set. We never published it. You're the first group to see it, I guess. But it just shows you how that the hormonal changes do affect the susceptibility to enteroviruses. Our conclusions were that we had a community-wide epidemic of aseptic meningitis in '83 due to Coxsackie B5, and CDC subsequently reported that B5 was the most frequently isolated enterovirus in the U.S. that year. And there was a previous epidemic in 1956 in Iowa, caused from B5. But Coxsackie B5 was cultured for the first time, I should say B5, for the first time on record in Jefferson County in late '82, supporting the hypothesis that the epidemic occurred among a large susceptible population. It was amazing. I remember going to two of these cases. I went to the hospital room, and it was a man and his wife. They both had aseptic meningitis. So they were in the same hospital room because they were man and wife. But we had a lot of meningitis that summer. Lastly, I'll talk about the possible effect of the H flu vaccine in Jefferson County. The Haemophilus influenzae, also known as the Pfeiffer bacillus, 1937, Father Gill wrote this article. He was mentioning that you could get the serum. You can get serum for the treatment of patients with meningitis due to H flu from the Massachusetts Department of Public Health. So this is in the days of serum therapy for infections. Penicillin was just about available, but this is serum therapy for H flu. And the Pfeiffer bacillus is what the previous name of Haemophilus influenzae was. And in Boston Children's Hospital during the years 20 to 31, the cases of meningitis, number one was tuberculosis. tuberculous meningitis in children. Number 2 was meningococcus, and number 3 was the Pfeiffer bacillus, followed by group A strep and the pneumococcus. We had a big interest in H flu during my years at the Jefferson County Department of Health. There was no vaccine generally from the time I got there until the time I almost left, or when time I left. And we were always getting cases from children. Did the child go to a daycare center? Did they not go to a daycare center? We did a lot of rifampin prophylaxis in daycare centers. Whether or not that helped, I don't know, but we did it. We go to the daycare center and give rifampin to the close contacts in the daycare centers. And this slide shows the incidence during one school year, 82 to 83, of H flu type B disease, invasive, which is either bacteremia or meningitis or both, in children in Jefferson County and age 3 to 48 months. So there were 30 cases, 20 were non-daycare center attendees, and 10 were in daycare center attendees. And if you calculate a rate, then it's higher in daycare center attendees. But I will admit, I don't know how we calculated the number of children going to daycare centers at that point. I'm sure there was some registry of somewhere that you could find out what the populations were in daycare centers. And so we calculated a rate. So it wasn't significant, but it was higher. And then the first HIV vaccine was licensed in 1985, but it was not very effective in children 18 months or younger. There was an improved vaccine in 87. So we undertook to look and see if there was any potential change in the incidence of H flu disease in Jefferson County. And we developed a table that you see here. And what I've circled is the difference between 1985 and 1986. The vaccine came out in 85. I don't know how frequently it was used, but usually pediatricians, once something comes out, it's available, they'll give it. And so I would assume that the vaccine was begun to be used in 1985, 86. And on the very last line, you can see that the number of cases in the 24 to 48 month-old group went from 7 to 10 to 10 to 1, whereas in the less than 17, it was 23, 20, 18, 28, so there was no change. So in fact, the vaccine didn't work in the youngest children, but may have worked in the older kids. So we put this together, and Joe and Richard sent it in the New England Journal. They took it as a letter to the editor, and it just kind of was nice to see that put in there. And you know, the vaccine was improved, and so now the vaccine's given, and I would imagine you don't see very much in the way of H flu. I'm looking at Richard. No? Okay, anyway. So that's the end of my presentation. I appreciate your attendance, your interest, your forbearance in listening to me ramble on about what happened in the past. Public health practice is more than keeping good records. That's what I was going to say, because the person said, yeah, it's more than that. There's a lot more than that. Happy anniversary, and keep up the good work. And thank you very much for coming.